Hello everyone, this is Vinu from Make Me RN, interpreting ECG rhythm for our heart blocks. So we can start with heart block today. Introduction to heart blocks. The AV node is the gateway to the ventricles. Impulses travel from SA node to AV node to bundle of his to bundle branches, and from bundle branches to Purkinje fibers to depolarize the myocardium. So you can see that in the image, from SA node to SA node to AV node to bundle branches, and then to the Purkinjes. We will focus on heart blocks originating at the level of AV node, bundle of his, and bundle branches. Heart block is a group of disease characterized by the presence of a block or obstruction in conduction pathway may slow down the impulse or completely stop the impulse from being conducted through from atria to ventricles. Like types of AV blocks. One first will be like first degree AV block, and the second degree AV block. So second degree when block is like classified into two types. First one will be second degree type 1. That's another, it's called Pinky Pack or Mobitz 1. And second degree type 2, that's Mobitz 2. And then like the final one is like third degree or complete heart block. First degree AV block, there is a consistent and constant delay in the conduction of electrical impulses through the AV node. So just keep in mind the two words like constant and consistent. Constant and consistent delay. And the other option will be like prolonged PR interval. Like PR interval will be like 0 point more, greater than 0.20. So like 0.20. It will be like greater than that, and it's happened like consistent duration. Usually well tolerated, no signs or symptoms, no specific treatment for this. And this is like expected. If you ask me, like, are you worried about this one? Not really, but still, if this is a new one, yes, I am. And you can see in the lead rhythm strip, like here, you can see like there is a consistency between the gaps, and you can see the PR interval is greater than uh, 0.20. So that's like here. Same thing with the one, two. Degree headwork implications are like natural aging is like one of the cause medical conditions like thyroid, inflammatory diseases, electrolyte imbalance, congenital athletes may have damage to heart, like myocardial infarction, cardiac surgeries, infectious process. So what you do for as a nurse, what you do, like assess your patient, that will be the answer for almost every rhythms. Like, yeah, you will assess your patient, notify MD if it is a new block, make note, monitor for higher degree heart block, like lead ECG if new or changed. So next comes to second degree type 1. That's like another word for that one is Wingy Pack, and or like Mobitz 1. For this second degree type 1, there is a progressive delay following each P wave in the conduction of electrical impulses through the AV until conduction is completely blocked. So there will be like progress delay in each P, and then like the conduction will be stopped, like missing QRS. Progressive lengthening of PR interval until QRS complex fail to appear after a P wave. That means like long drop. You can see in the image, like there is like notice the progress lengthening of PR interval until like QRS complex is dropped. Like that's called monkey back. So progress, progress, drop. Then again it goes same thing. In this one also you can see that one, like, yeah, progress, delete. Increase vehicle turns, like Medication. Some of the medications can cause this heavy electrolyte imbalance, athletes, hypoxemia, reversible heart damage. It can result from an inferior myocardial ischemia, cardiomyopathy, Lyme disease, or following cardiac surgery. Nursing action same like what I told you before. Assess the patient, notify MD if it is new block, make note of the node on card and monitor for worsening block. Told ECG whether check for like whether it's symptomatic and treat for the cause. May need to give atropine. Second degree type 2. So AV block characterized by intermittent non-conducting P waves without progressive prolongation of PR. This block tends to originate lower down from the AV node into the bundle of His. Like that, like you can see that in the image here. Obitsu 2 is an all or nothing phenomena where being the Parkinson cells suddenly and unexpectedly fail to conduct a supraventricular impulse. That means like it causes a sudden drop of QRS when conduction is permitted through the AV node or bundle of it. It will do so in a regular fashion and looks like a normal QRS pattern. AB conduction ratio can vary or stay consistent. That is like 4 is to 3, 3 is to 2. The more non-conducting QRS complexes there are the more symptomatic. There are more non-conducting QRS complexes. There are the more symptomatic the patient will be. That means like the end result will be like decreased cardiac output. Second degree type 2 implication, electrical imbalance, medication overdose make more likely due to structural damage of heart or any other diseases like MI, cardiac surgery, infectious process, fibrosis, or sclerosis of myocardium may be temporary or permanent depending on the impairment of the conduction system, potential to progress to a complete heart block. So what we do as a nurse, like as a patient, notify MD if it is a new block or new symptoms, make note of a monitor for worsening block, tolerate ECG, symptomatic treat for the cause, may give atropine or Isopral, less likely to work, patients more likely to require pacing. Second degree block, you can see that in the strip, already marked it over there. So yeah. Third degree block, complete heart block. That means like the node is closed, the path is closed, so nothing happening beyond that point. Complete absence of conduction of electrical impulses through the AV node, bundle of his or bundle branches, characterized by independent beating of atria and ventricles. Essentially, it's two separate rhythm. Escape pacemaker cells activate in the ventricle since the impulses from the atria does not make it through the ventricle. So notice like there are like independent PVs marching through the strip, no relationship with the QRS complexes. Implications for third degree electrode imbalance, medical overdose, heart diseases, damage to heart, MI surgery, infectious process. What we do, assess the patient, notify MD if there's a new block worsening symptoms, document and monitor, tolerate ECG, have pacer pads ready, and reassess equipments nearby. Symptomatic may try atropine, likely onward, dopamine support is better, will likely recur pacing. Throughout, you can see